there's a very famous and influential paper by two pharmacologists, Carson and Cruz, and their core argument was that you can transform traditional medicines into modern drugs in the sense of chemical entities. In a way, nothing new, but what is new is that they argued in 2007 that industry should focus on it. So it's part of this cycle of interest in the industry in novel products derived from nature and derived from traditions, indigenous traditions. They call it knowledge-based drug discovery, which I find quite fascinating, because the previous paradigm was high throughput screening. So the underlying implication is this is not a knowledge-based drug discovery, but more a random approach. The other approach is by, and the other perspective I've included here is by Darrell Posse, who highlights that actually what we are doing here is something completely decontextualized. And certain Carson and Cruz are decontextualizing this very dramatically. And we are in essence destroying the sacred balance between all life forms by making this global commodities. So along these two lines will be the discussion. On the one hand, the question, the local and the global, and the other hand, to a certain degree, what is the final outcome? Is it something which is more local, or is it something which is something we use, let's say, in a clinical way if we develop new medicines? There's one other element which is missing. September 15th, 1997. Do we have any idea what happened on that day? I didn't until a few weeks ago. The launch of Google. And that's the other element which comes into the discussion here. I think what we are seeing is a dramatic change, and I've tried to do it in this way. When I did my ethnobotanical field work, there was certainly a very restricted link between a local community and the wider world. And there were these sort of little ambassadors going either way. Scientists, missionaries, government officials, or whatever have you. The current situation is much more what I've shown in this somewhat busy thing on the bottom, highlighting that in fact we have a very dramatic increase in the exchange of ideas, knowledge, and products. The three examples I'm looking at, one is Hoodia gordoni, another species of Hoodia, pretty well known as a weight loss substance. Acai berries, or acai, Euterpe oleracea, a Brazilian product, again slimming, etc. And Salvia divinorum, which again links us to the example we gave before. Now let's start with Hoodia and sort of breaking down boundaries. Hoodia is the ideal example. If you look in your spam box, aside from Viagra and a few other things, you're very likely to find Hoodia in your spam box. It is, makes health claims like the ones here. I don't want to read it, it doesn't really matter. They're all better than the other one. They're all wonderful, they're all great, and of course they're all cheap. But what actually happened, if you look at it in a very brief history, in the very brief history of Hoodia? Hoodia originally was used by the Khoisan Bushmen of southern Africa. It's a plant which was used there basically to control thirst and hunger. The documents go back to the middle of the last century. That's where we have the first documents about it. South African researchers identified this little compound, which I've put on the right-hand side, as one of the key active ones. And if you know a little bit of pharmacology and you know a little bit about chemistry, one of the first questions you ask yourself, A, how good is this going to be as a drug lead? And B, how safe is it? But there's a little startup company which pushed the whole thing, and they were very successful, and they developed this naturally occurring appetite suppressant in first instance, they licensed it from the South Africans and then licensed it further to Pfizer. If you know a little bit about Pfizer, you know they're into the business of making medicines. Keep that in mind. They started in 1998, so about 12 years ago. It entered phase 1 clinical trials very fast, and in 2003 Pfizer said, thank you, we are no longer interested. Now what happens next? In 2004 it's again licensed, this time to Unilever. You'll say, Unilever? Medicines? No. Yes, they actually were now interested in developing a food supplement. Before this, Phytopharm took the very wise step to make sure that the South African Research Institute and the Khoisan develop a benefit sharing agreement so this product can actually be used. What you get today on the web is in a way an outcome of this process. The big challenge for Phytopharm was, if you think in terms of what's happening commercially here, they needed to make sure that venture capital pumps in money into their company. So they had to bring the good story across. And if you look at the timing, Hooja just came to the international attention shortly after the launch of Google. So that brings these things together. Sort of very sadly, Unilever decided in 2008 to stop further developments, and it's now back to Phytopharm to find a new solution to it. I would guess that what you get if you were to buy anything out of your spam in tray, what you get, if you're lucky, it's sawdust. If you're unlucky, it is something else. So just as a note of caution, if you go back to the first slide, remembering this one, this is a desert plant, slow growing, and the demand is certainly much higher than actually what is available on the world market. Therefore, if you're lucky, it's sawdust. So what does it really tell us? I think it tells us it raises a whole series of questions. One is really this issue about the internet-driven development of a drug. The question of pharmacological activity, which is very controversial, the safety, and obviously, last but not least, issues relating to benefit sharing, something which is outside of the scope of this presentation. A very brief other example, Euterpe oleracea, a very similar situation in terms of the boom. This has recently been marketed as a food supplement, claiming to have superior health benefits. It makes you thin, it makes you beautiful, eternally young, and everything. So take it and you'll live forever. It's allegedly based on a very special phytochemical composition, which, if you look into, is not very special, but that's life. But it has pretty prominent antioxidant activity. Here enters another interesting thing, and this is Euterpe oleracea featured very highly in some American programs. Most importantly, the Oprah Winfrey show, who for the first time in 2004 discussed this and in fact did not advocate this as a health food supplement. She only discussed it.